Hey everyone, and welcome back to the channel. Today, we're tackling a topic that affects millions of women but is often discussed in whispers: hair loss. Seeing more hair in your brush or on your pillow can be incredibly distressing. It can shake your confidence and make you feel alone. But I want you to know you are definitely not alone, and there are real effective ways to address it. In this video, we're going to dive deep into why female hair loss happens, explore the different types, and most importantly, talk about the solutions and treatments that can help you get your hair and your confidence back on track. So, let's get started. First, it's crucial to understand that losing some hair is completely normal. We all shed about 50 to 100 hairs a day. It's when you start noticing a significant increase in shedding, a widening part, a thinner ponytail, or visible patches of thinning that it's time to pay closer attention. Unlike male pattern baldness, which often presents as a receding hairline or a bald spot on the crown, female pattern hair loss, or androgenetic alopecia, typically looks different. For women, it usually starts with diffuse thinning over the entire scalp, with the most noticeable thinning occurring along the part line. You might notice your scalp is more visible than it used to be. This is the most common cause of hair loss in women, and it has a strong genetic component, often becoming more apparent with age, especially after menopause. But genetics aren't the only culprit. Let's talk about some other common causes. One big one is telogen effluvium. This sounds complicated, but it is basically a type of temporary hair shedding that happens after a major stressor to your body. Think about major surgery, a serious illness, significant emotional stress, or even childbirth. About 3 to 6 months after the stressful event, you might experience a sudden and sometimes dramatic shedding of hair. The good news is that once the stressor is removed and your body recovers, your hair typically starts to grow back on its own. Hormonal changes are another huge factor for women. The hormonal shifts during pregnancy can actually make your hair look thicker and more luscious. But after giving birth, as your estrogen levels drop, you might experience that postpartum shedding we just mentioned. Similarly, conditions like polycystic ovary syndrome, or PCOS, can cause hormonal imbalances that lead to hair thinning on the scalp, and of course, menopause. The decrease in estrogen and progesterone during menopause can cause hair to grow more slowly and become finer, contributing to overall thinning. If you're experiencing hair loss along with symptoms like fatigue, weight changes, or mood swings, it's a good idea to get your thyroid levels checked. Nutritional deficiencies are another key area to investigate. Your hair follicles are like tiny factories that need the right fuel to produce healthy hair. If you're deficient in key nutrients like iron, zinc, vitamin D, or B vitamins, especially biotin, your hair growth can suffer. Iron deficiency anemia is a particularly common cause of hair loss in women, especially those with heavy periods or who follow a vegetarian or vegan diet. Crash dieting and rapid weight loss can also shock your system and trigger hair shedding. It's all about providing your body with a consistent supply of the building blocks it needs. Finally, we have to talk about how we treat our hair. Traction alopecia is hair loss caused by repeatedly pulling on your hair. Tight hairstyles like high ponytails, tight braids, weaves, or extensions can put constant strain on the hair follicles. Over time, this can cause permanent damage and prevent hair from growing back in those areas. Harsh chemical treatments, excessive heat styling, and aggressive brushing can also damage the hair shaft, leading to breakage that can be mistaken for hair loss. Being gentle with your hair is one of the most important things you can do. So, now that we understand some of the whys, what can we do about it? The very first step, and I can't stress this enough, is to see a doctor or a dermatologist. Self-diagnosing can be tricky, and since so many factors can contribute to hair loss, a professional evaluation is key. They can run blood tests to check for hormonal imbalances, thyroid issues, and nutritional deficiencies. They can also examine your scalp with a special microscope to determine the type of hair loss you're experiencing. Getting an accurate diagnosis is the foundation for finding the right treatment. Let's talk about some of the most common and effective treatments. The only FDA-approved topical treatment for female pattern hair loss is minoxidil, which you might know by the brand name Rogaine. It's available over the counter in 2% and 5% foam or liquid solutions. It works by prolonging the growth phase of the hair follicle and can help to regrow hair and slow down further loss. It's not a quick fix, though. You need to be consistent and apply it every day, and it can take at least 4 to 6 months to see results. And if you stop using it, the hair loss will likely resume. For hair loss related to hormonal issues, your doctor might prescribe medications. For example, spironolactone is a prescription medication that is often used off-label to treat female pattern hair loss. It works by blocking the effects of androgens, which are male hormones that can contribute to hair thinning in women. Birth control pills can also be prescribed to help regulate hormones and reduce hair loss, especially for women with PCOS. Supplements can be a great support, but they work best when you're correcting a specific deficiency. If your blood work shows you're low in iron, an iron supplement can make a huge difference. The same goes for vitamin D, zinc, or biotin. However, taking a bunch of supplements without knowing if you're deficient is always helpful and can sometimes be harmful. A good quality multivitamin can be a safe bet, but targeted supplementation based on blood work is always the best approach. Focus on a balanced diet rich in protein, fruits, vegetables, and healthy fats. Think lean meats, fish, eggs, nuts, seeds, and leafy greens. There are also more advanced in-office procedures. Platelet-rich plasma, or PRP therapy, is a popular option. It involves drawing your own blood, spinning it in a centrifuge to concentrate the platelets, and then injecting this platelet-rich plasma into your scalp. The growth factors in the platelets are thought to stimulate the hair follicles and promote new growth. It usually requires a series of treatments. Another option is low-level laser therapy, or LLLT. This involves using caps, combs, or headbands that emit red light to stimulate the hair follicles. You can do these treatments at home, and while results vary, some studies show it can help increase hair density. And of course, hair transplantation is a surgical option for more advanced cases. It involves moving hair follicles from a dense area of your scalp, usually the back of your head, to the thinning areas. It can provide very natural and permanent results, but it is a more invasive and expensive procedure. Beyond medical treatments, there are so many things you can do in your daily routine. Be gentle with your hair. Use a wide tooth comb, avoid brushing your hair when it's wet and at its most fragile, and reduce the use of high-heat styling tools. When you do use heat, always apply a heat protectant. Try to avoid those super tight hairstyles that pull on your roots. Scalp care is also essential. A healthy scalp is the foundation for healthy hair. Use a gentle sulfate-free shampoo and consider incorporating a regular scalp massage to boost circulation to the follicles. Finally, managing stress is huge. Chronic stress raises cortisol levels, which can negatively impact your hair cycle. Incorporate stress-reducing activities into your life, whether it's yoga, meditation, exercise, spending time in nature, or just taking a few minutes each day to breathe deeply. And remember to be patient. Hair grows slowly, about half an inch a month. It takes time for any treatment to show results, so consistency and patience are your best friends on this journey. Dealing with hair loss can be an emotional roller coaster, but remember that there are solutions and support available. Talk to your doctor, explore your options, and find what works for you. And if you're feeling overwhelmed, don't hesitate to reach out to a support group or talk to a mental health professional. Your feelings are valid, and you don't have to go through this alone. I hope this video has given you some clarity and hope. If you found it helpful, please give it a thumbs up and subscribe for more content. Let me know in the comments if you have any questions or your own experiences to share. Thanks so much for watching, and I'll see you in the next video.